Hi everyone, welcome back to one more interesting class on pharmacology. Myself, Dr. Padmanabha T S, your pharmacology faculty. So, welcome back again. So, let's study about calcitonin. So, calcitonin is also called as hypocalcemic hormone. So, please remember, calcitonin is also called as hypocalcemic hormone. How we can remember again? There is a calcium, there is a inhibitor. So basically it inhibits the calcium levels in the body, thereby they decreases the calcium levels. So that's why they are called as hypocalcemic hormone. That means they are going to decrease the calcium levels in the body. So they are present on the parafollicular cells of the thyroid gland mainly, and their levels will be proportional to that of the calcium levels. That means the calcitonin level will going to increase if there is a increase in the blood calcium levels. Calcitonin levels will going to decrease if there is a decrease in the blood calcium levels. So basically its presence or concentration is proportional to the calcium levels. Very important. And what is the actions or mechanism of action produced by the calcitonin? So calcitonin has got opposite action to that of the parath hormone, opposite or negative action. So you can remember on. So on inhibition means it will have a negative effect on the parath hormone. So opposite effect on the parathyroid hormone. That means it will going parath hormone will going to increase the calcium levels, whereas they inhibit the bone resorption from the osteoclast, thereby decrease the calcium levels in the blood. So basically calcitonin has got the opposite effect to that of the parathyroid. Very important. They act by inhibiting the bone resorption of the osteoclast. So action will last for 8 hours, and also it has got additional actions such as it inhibits the proximal tubular reabsorption of the calcium as well as the phosphate. And please remember, whenever there is a hypocalcemia, so conditions like hypocalcemia can override override the calcitonin effect by decreasing the calcium filtered through the glomerulus. Thereby there won't be any much calcium available that will going to be inhibited for reabsorption. So calcitonin is available synthetically in the form of synthetic salmon calcitonin. And what are the side effects which can be associated with calcitonin? So it is a hypocalcemic hormone. It can cause nausea and flushing. So since there is a decrease in the calcium levels, it can cause tingling sensation in the fingers mainly. Apart from that, these are the rare conditions which can be produced. That is a bad taste, allergic reactions, flu-like symptoms. It is flu-like symptoms and the joint pain. So what are the uses? So it can be used in case of hypercalcemic condition. Since it is a hypocalcemic hormone, it will going to decrease the calcium levels in the body. So the conditions which are associated with increase in calcium will be the condition where you can use the calcitonin. So those are the hyper those are the hyperparathyroidism, hypervitaminosis D, osteolytic bone metastasis, as well as hypercalcemia of malignancy. In all these conditions, there will be increase in the calcium. So apart from that, they are also useful in case of the postmenopausal osteoporosis in case of women. Very important thing to remember is calcitonin can be administered through nasal spray. It gets absorbed through the nasal mucosa. And also it is used for Paget's disease. But remember, in Paget's disease, the preferred drug of choice will be your bisphosphonates. And very important, they have asked many times in your exam, there is the which is the drug that can be used for diagnosis of the medullary carcinoma of thyroid. That is your calcitonin medullary carcinoma of thyroid. So basically, what is calcitonin? Calcitonin will going to inhibit the calcium levels. So they inhibit the calcium levels, mean they basically their action is to reduce the calcium levels in the body. So basically it will produce the on off effect. So it will going to cause opposite response of the PTH. Basically they are going to inhibit the osteoclastic activity. So apart from that, you should remember it is given through nasal spray, and used for diagnosis purpose of medullary medullary carcinoma of thyroid. So these are the things which you should keep in mind before going to the exams. Thank you.